The world we live in is inextricably linked. Almost 75% of all emerging infectious diseases are zoonotic, originating from animals, the majority from wildlife. We see how destruction of nature and the unsustainable use of natural resources, including the extraction and use of wildlife, increase risks of zoonotic spillover, a danger that can lead to pandemics.
We know that wildlife is not our enemy. It is an integral part of biodiversity on Earth. It is our human behavior that puts us at risk. Environmental health, animal health, and human health are fundamentally interconnected.
Therefore, we need a holistic approach that is collaborative, multisectoral, and interdisciplinary, and works at the local, regional, national, and global level. We need to focus on preventive and sustainable measures, and we need a joint approach to reduce health risks from wildlife trade and consumption.
In September 2021, the International Alliance Against Health Risks in Wildlife Trade was launched as an inclusive and interdisciplinary platform. To date, more than 100 national and international political and civil society organizations are participating, including indigenous communities as well as research institutions.
The Alliance is driven by evidence-based insight. We address the entire wildlife trade spectrum, from hunting and handling through trading to consuming wildlife and its products.
To reduce the risks of future outbreaks, epidemics and pandemics, we translate the commitment, knowledge and political will of our members by providing and communicating evidence, helping to design countermeasures, and supporting and evaluating interventions. Finding solutions that work, while concurrently improving health, equity and well-being for all species through a One Health approach.
Strategies to identify and address health risks are complex. They must be context-specific and culture-sensitive, and require interdisciplinary knowledge exchange, well-coordinated inclusive planning, co-creation and joint actions of many different actors.
The Alliance helps to join forces for a common cause and expand each member's radius. We offer matchmaking among members to enable new collaboration and partnership. We translate scientific evidence, insights from indigenous communities, and knowledge systems into concrete policy recommendations.
To drive actual changes on the ground, we broker knowledge and insights. We encourage and empower evidence-based orientation and regulation. By offering guidance to involved communities and authorities, we help change behavior and improve policy implementation.
The membership is based on transparency, equal terms, and equal say. We acknowledge the complementarity of the very diverse actors and action fields involved. Through our combined knowledge, we'll narrow the gap between science and implementation, and global awareness, policies and practice will be improved.
With our joint action, we will help to substantially reduce unnecessary health risks posed by close contact across the entire wildlife trade spectrum. This is our vision, a world of healthy and safe coexistence of people, animals, and the ecosystems that they are part of.
What a nice video. Welcome everybody. Thank you for having joined us today for this webinar. My name is Dr. Alexandre Fedievski. I'm the head of the Emergency Preparedness and Resilience Department at WOA Headquarters, World Organization for Animal Health. And together with my colleagues from the wildlife team and the Alliance Secretariat, We are really delighted to welcome you in this event organized in the context of the One Health Festival, organized by France following the One Health Summit earlier this month. And thank you to the organizer to give us this opportunity to talk about the International Alliance Against Health Risk in Wildlife Trade and the work we intend to do. The alliance has been initiated by the German government after the COVID-19 pandemic and operated by GIZ until now its transition as a secretariat to OA and our team, and that's a big honor for us. This alliance brings together over 180 organizations and more than 500 experts worldwide. Its objectives are first to reduce the risk of zoonotic spillover and stepping up the response, but also taking into account upstream drivers. Its second objective is to enhance international and national awareness, to narrow the gap between science and policy, and support implementation. Wildlife trade is an emblematic topic for a One Health approach. But it's also a very complex one, and this is why we really need to work together. We know how people can have the temptation to find simplified issues and simplified answers. It will not work. We really need to see at scale, at specificities when we talk about wildlife trade. And today with this webinar, we hope we will illustrate to you the approach of the islands to bridge the broader picture to the local actions and their specificities, and to be as inclusive as possible. We intend to have interactive Zoom interface to raise your questions so that we can monitor that they are all answered, hopefully, by the end of this session. Before concluding, I would like to thank all speakers and members of the Alliance Steering Committee, as well as our GIZ colleagues for their engagement preparing this event. But now let's start, and my pleasure is now to hand over to Dr. Suzanne Lieberman, Vice President for International Policy at the Wildlife Conservation Society, member of the Alliance Steering Committee, who has more than 30 years of experience in international biodiversity conservation with expertise in wildlife trade, wildlife trafficking, and intergovernmental policy. Suzanne, you have the floor.
Thank you very much. Can you see my slide and can you hear me?
Clear and loud. Thank you.
Thank you very much. And thank you very much for inviting me to share some introductory remarks that later speakers will pick up on. Thank you as well for that wonderful video, which probably said everything I need to say. So I'm going to talk about, if I can actually figure out how to advance a slide there, I'll illustrate a few points that have already been raised in the video just to reinforce. What do we know? We know that across 25 high-risk viral families, there are estimated to be 1.7 million unknown viruses, 700,000 of which are likely to have the potential to infect humans. But based on the best science that we have, we understand a very tiny percentage of those. For example, just looking back at COVID-19, for every known coronavirus, there are thousands of unknown coronaviruses. So if we monitor wildlife and wildlife trade for known viruses, we're missing the vast majority. Zoonoses, because we're using that term, which is familiar and boring to many of you, but new to some of the others who are joining us. Zoonoses are diseases that move between animals and humans. Emerging infectious diseases are dominated by zoonoses, and about 72% of those originate in wildlife, including historically, of course, the measles virus from domesticated animals. And the frequency of these emerging infectious diseases is increasing. Also, and we heard in the video, pandemics of zoonotic origin are enabled by the increased human-wildlife interface that results from commercial markets for wildlife, Urban markets, for example, not exclusively, but for example, those in live wild birds and mammals, wildlife farms, and land use changes, deforestation, land use, land degradation increases that interface between people and wildlife. What's critical is prevention at source. National commitments, multilateral commitments to address prevention at source in an integrated trans-sectorial manner using a One Health approach. Using the term prevention at source, and you'll hear that from other speakers, what does that mean? It means basically preventing the spillover of pathogens from wildlife to livestock or people and subsequent disease, preventing it from happening in the first place. There's also, we could talk about preparedness and preventing further transmission, but prevention at source is key, and it is critical. It is the single most effective, and I stress, cost-effective way to prevent pathogen spillover, to limit suffering, to limit the loss of human life, to limit and avoid economic disruption, and to mitigate climate change, biodiversity loss, and global inequities. Prevention at source can accomplish all of that. And actually, we know how to do it. And I just put this slide up to make a point because people often say, well, wildlife is risky. There is a hazard in the pathogens that may be held by wildlife, as I've mentioned, and as was mentioned in the video. But the risk only occurs due to land use change, deforestation, exploitation, legal and illegal wildlife trade that the Alliance is so focused on, and commercial markets. That increases spillover and therefore increases the risk. So it is that interface between the wildlife in the wild, in the forest or savannas, but in the wild, as that interface increases, that's where we have the risk. We have the risk of spillover, where viruses, pathogens such as viruses, can spill to livestock, other wildlife, and humans. And then through increased transportation, entry into urban environments, that amplifies the risk and amplifies the spread of pathogens, which can indeed, and does, and we experience that with COVID, cause epidemics and pandemics. I want to make a point that the risk from commercial wildlife, from wildlife trade, from human consumption, the risk isn't from eating wildlife, it's the whole chain from the wild and the handling of the live animals. Whether that trade is legal or illegal, there is significant risk. Whether that trade is, this is what the science shows us, whether that trade is from the wild or from captive situations such as wildlife farms, that is not risk-free. There is still risk. Indeed, and I just want to set the stage for the wonderful speakers and panelists that will follow me, wildlife trade is a risky business. It's risky from a biodiversity perspective, but today we're talking about the risk from a pathogen spillover health perspective, a One Health perspective affecting other wildlife, domestic livestock, and people. Live wildlife carry multiple pathogens, and we know from the science that stressed and injured animals have weakened immunity, and that further increases the risk of spillover of pathogens. We know that the mixing of species in markets and in transport increases the risk. That is very risky because there will be more exchange of pathogens between species. Therefore, the more trade, the more wildlife in trade, the greater the risk. And the Alliance and the wonderful members of the Alliance, and now WOA as the Secretariat, we're all working together to mitigate that risk. And this just an introductory, and I'm happy to answer questions that you may have. And thank you very much for your attention. I look forward to hearing the other panelists and to answer your questions. Thank you.
Thank you so much, Dr. Lieberman, for such an insightful keynote, and also yeah, you have given us a very interesting overview of the scale of the health risk in wildlife trade, and also thank you for clarifying the meaning of the term of prevention at the source. So now we'll have a panel discussion focusing on the actions, on the how. How can we prevent and address health risk in wildlife trade? More specifically on the policy and the implementation on the ground level. So let's start. We are very fortunate to hosting 5 outstanding panelists with a very diverse background and extensive experience in public health, wildlife conservation, animal welfare, and wildlife trade. And we have, so I will ask you while I mention your names, please to turn off your video. We have Barbara Mas, who is head of conservation of endangered species at NABU International. NABU is in charge of Nature and Biodiversity Conservation Union. Welcome, Barbara. We have Hong-Ying Lee, Dr. Hong-Ying Lee, who is Senior Program Manager and Senior Scientist at Columbia Climate School. Welcome, Hong-Ying. We have Craig Stephen, who is Director of the McAran Institute and Clinical Professor at the School of Population and Public Health at University of British Columbia. Welcome. We also have Matthew Collis, Senior Director on Policy at IFA, the International Fund for Animal Welfare. And we have, welcome, Matthew. And we have Sarah Ferguson, Director of Policy at Traffic, those who are not aware of Traffic, the Traffic is a global organization dedicated to monitoring and combating illegal wildlife trade. Welcome to all of you, and thank you so much for your time for being here today. So let's start. Let's begin with a general question to all of you. So Dr. Lieberman just explained to us, how wildlife trade can contribute to the propagation of zoonotic pathogens. But to someone who is watching today and who does not usually come into contact with wildlife or wildlife markets, this might seem like a distant problem, right? So I will ask you maybe if you can share in 1 or 2 sentences, why should this matter to them, and what are the possible connections to their daily life? Maybe Craig, do you want to start?
Sure. Thanks, Sophia, and thanks everybody for being here today. When I first heard this question, the thing that came back to me was the old public health truism that people are more likely to act to protect what they value than to avoid what they fear. And I think the most important part of this question is not the pathogen question, but it's the wildlife question. None of us are disconnected from wildlife. We all live around wildlife. Sometimes we call them pests because they live near us in cities. Many of us who eat seafood, the biggest wildlife trade in the world. And so I think the question here is to not increase the fear of people of pathogens and pandemics, but the value for wildlife and understanding how caring for wildlife is important as a way to manage this wildlife risk as well.
Indeed, very interesting. What would you say, Barbara? What's your view on this?
Thank you so much, Sophia, and thank you everybody for being here. I would say that even if people never directly interact with wildlife, they're still exposed to the risk generated by how we interact with nature as a whole. So pathogens emerge at the human-animal environment interface, which is the system embraced by the One Health concept, that you have a healthy planet by having healthy animals, a healthy environment, and therefore healthy people. But once spillover occurs, global travel and trade networks allow pathogens to spread very rapidly across countries and continents, as we experienced in the case of COVID. The key point is that wildlife trade is not an isolated or local issue. It is part of a globalized system of extraction, transport, and consumption that creates opportunities and contact for pathogens to adapt, mix, and spreads. And once that happens, the consequences, health impacts, economic disruption, and social instabilities are shared globally. So prevention at source is not just a conservation issue, it's a matter of collective self-interest.
Mm. Yeah, I think when we talk about spillover, it's also in recognizing that how interconnected and interdependent we are, right? The world is. And the COVID-19 pandemic shows that, and also the far-reaching consequences on public health and animals and ecosystems. So I think what we also witnessed with the pandemic is that it also created momentum, right, for taking action in preventing pathogen spillover between wildlife and people. And one example of that is the creation of the alliance. But then, Sarah, in your opinion, has that urgency been sustained in the international policy agenda? Is this momentum, has this momentum faded over time? What's your view on this?
I think that it has faded over time. I think that it still is in the consciousness of most governments and stakeholders, but maybe not, I mean, certainly not to the extent that we saw it during the COVID-19 crisis. During COVID, we did see some significant momentum. We saw some new regulations and guidance that were aimed at improving safety of wildlife handling, housing, and transport, which, as Sue mentioned, are invaluable to addressing these zoonotic risks. But then the attention since then has shifted to other concerns. I mean, global war, poverty, other things that need addressing, and the economic fallout from COVID-19, I think. And so the specific focus on those zoonotic origins of COVID has faded, even though those underlying risks are still there for sure. But during even during COVID, like our research on behavior change, traffic's research, in looking at the understanding of disease risk, it differed really significantly across regions. And even then, we realized that our behavior change messaging needed to highlight the environmental impacts of wild meat consumption, which actually resonated better than these zoonotic risks. But with all of that, I think the period since COVID has enabled some more integrated framing through the One Health approach, which we've seen gaining traction in a number of global biodiversity and policy agendas. And it's increasingly reflected in a lot of international discussions. And so I think the challenge now still is to translate some of the broader recognition into some of these practical cross-sectoral actions and ensure that wildlife trade risks are being addressed alongside other high-risk interfaces like agriculture. Yeah, I don't want to go on. I don't want to take too much time. So
No. That was perfect. But then, yeah, just following on the last part that you said of, so we have policies in place, but the gap is to the practice, right? To the implementation side. Matthew, do you see it the same way? And also, I wonder to both of you, Sarah and Matthew, like, what are the like what if there are new policies that need to be created or the existence that need to be improved? If you would like to pinpoint like which one could have the greatest impact. But let's just start first, Matthew. Like, yeah. Also, we are curious to hear if you share the same view.
Yeah, thank you. And I do. I think I think Sarah, I think all the speakers on the panel so far have captured the points extremely well. And to Sarah's comments, yes, I think we have seen some progress since COVID, particularly with, as Sarah mentioned, some of the guidelines and things that have been produced, including by WER themselves, the pandemics agreement, of course. But then, it was to some extent a struggle to get prevention at source into that pandemic agreement, because I think by human nature, we're very much better at dealing with something that when it's happened than thinking about prevention. And from a conservationist point of view, I was very hopeful that actually that discussion moving into public health world might improve that, because the public health sphere has often been much better at kind of prevention as a tactic than we have been in some cases in other fields. But even then it was still getting this idea that the prevention concerns are not about just preventing the spread of something once it's spilled over, but actually how do we stop it spilling over in the first place? And that's where it really comes into contact with the conservation world. And so I think we have seen some advances in those areas, but it's also as Sarah mentioned, that challenge of going from this kind of global level recognition and bigger picture piece to how is that practically implemented on the ground in case by case situations which vary dramatically in their context. And I'm hopeful the other panelists who are working on some very specific projects will be able to shed some light on how we can see that happen in practice. Because I think there are good examples, but they tend to be more sporadic and isolated rather than seeing it as a kind of global progression. And I think maybe one of the biggest barriers still to that, and it's kind of the holy grail in policy and government implementation world, is this functioning in silos. Even though we talk about a One Health approach that tries to bring these things together, my experience, at least from the governments we work with, is it's still dealt with very separately. And we even see that play out in policy discussions. Say, for example, the Convention on International Trade in Endangered Species has been looking since the COVID pandemic at how it deals with this issue in relation to wildlife trade. But so much of that discussion gets hung up on mandates and whether there's a mandate or not on these issues, and it's reflective of that broader issue of siloed governments. We have in many countries, animal health and wildlife health are dealt with separately to issues to do with endangered species or conservation. And I think so much so that's one of the areas that still hampers that translation of policy into practice that Sarah was talking about.
But and what about the translation um, of the animal welfare to these policies? Thinking about One Health that is embracing, as you said, and other panelists have also mentioned this before, like we're embracing this interconnection between human health, animal health, the ecosystem health. But when we talk about health risk in wildlife trade, it seems that many people associate it or first think about human health risk. And thinking about the animal health, sometimes the animal welfare it's not considered.
Absolutely.
Right?
Yeah, and it
How is it translated also in the discussions at policy level?
Yeah, and again, it's an interesting one because in so many, particularly international policy spheres, they don't feel again that they have a mandate to discuss welfare, and that's something that's dealt with on a national level. But actually, animal welfare is such a key component of animal health, whether that's in agriculture or in wildlife that's being traded. And we know that animals that are better cared for, that are contained if they're in a captive environment in good condition, are less likely to shed pathogens. So, in the same way that agriculture that's well looked after, agriculture animals that are well looked after have a much lower disease profile in general. So we need to see approaches to animal welfare as a part of the solution to this. And it's not the total solution by any means, but it's a significant one in terms of controlling risk of pathogen spillover.
Correct. Yeah, and also because I'm remembering what Dr. Susan mentioned. So it's not only about safe wildlife trade, safe and legal wildlife trade, but also taking into consideration the welfare, because also the animals faced so much stress and very detrimental conditions that affects their weaken their immune system and then contribute to the propagation of diseases. So moving to the field, we're curious to hear more about practical insights and hopefully learn more about what the Alliance has done about this in the past year. So we know that the Alliance has supported a range of projects aimed at managing health risk at the source of wildlife. So Hanking, let's bring you in. We also know that Alliance work has put emphasis on emphasis on behavior change and community engagement. Could you walk us through a concrete example in this, maybe sharing some lessons from the
Yeah.
Alliance work?
Sure. Thank you, Sophia, and very nice to be here with everyone. So the Alliance does this support different projects who are tackling the zoonotic risk, health risk in wildlife trade from different angles. And some of them were focusing on pathogen discovery, some of them were focusing on policy change, and a few of them focus on behavior change. So first of all, kudos to all those project teams who are doing great work on the ground. From my perspective, looking at those projects, especially those focused on behavior change, one of the things is, of course, we have to acknowledge the challenge is that behavior change really takes time. So one of the lessons is really how we can sustain these efforts and then how we can actually evaluate the result of those behavior change efforts. So some of projects really, if we're talking about what has been worked, what hasn't worked, I saw some of projects really focusing on local community engagement. They achieved some of the outputs by really matching the efforts with local value, with local needs. In this way, they do create sort of the ownership of the local community, local actors. I think that's one of the pathways the project were trying to create the sustainable efforts on the ground. And the other things I saw from the projects, really, they're trying to engage diverse actors on the ground, including the religious leaders and the local community leader or local associations. And I think from that, we learn the key lesson is really how we can better engage local actors. And another thing I saw in the chat is how we can better communicate the message. Because oftentimes when we try to go to community talking about zoonotic risk, we don't want to create fear. And we also want to adapt the message based on local context, because wildlife trade or farming or harvesting wildlife sometimes is a part of a local livelihood, local culture, or local income. So the communication also matters a lot, how we put this message into local context and to be adapted, to be recognized, to be understood by local community. So I will stop here.
No, very interesting. Thank you, Hanging. But then, I mean, we are a bit almost short of time. We need to unfortunately, start wrapping up this session. So I would like to just ask you, to each of you, perhaps just one sentence, maybe you can expand a little bit. But if you had to pinpoint a single priority action, or maybe let's try one or two priority actions that governments or the international community should take over the next 12 months, what will it be? I know it's a bit controversial and tricky. Anyone that would like to jump in?
I'm happy to jump in. To me, I think one of the biggest problems we have here, and Matthew touched on it, is it's the implementation gap.
Mm-hmm.
Susan mentioned it as well. We know what we believe we know what to do, but clearly we don't, in the fact that it's not being done. So there needs to be systematic investment in evaluation of what's working, brokering that knowledge to others so we can amplify what we know more quickly. We can't just keep investing in describing the problem more. We have to
Mm-hmm.
invest in how do we do.
Perfect. Thank you so much, Craig. Someone else?
Yeah,
Maybe Matthew? Yeah.
maybe I can follow from Craig in that. I think he's absolutely right. And the thing that concerns me in that context is essentially we're carrying on with wildlife trade as we were before, and nothing really has changed in terms of volume of trade, in terms of diversity of species, etc., that we saw before the COVID-19 outbreak and before every other pandemic and epidemic that's been spilled over from wildlife previous to that. So I think we really need to start to get serious about tighter regulation around wildlife trade in a way that I just haven't seen in more than a few isolated examples since the COVID pandemic. And perhaps that means a change of mindset, start looking at things, switching the burden of proof around. The assumption has always been we can carry on until something goes wrong. Well, then maybe now we need to be putting the burden of proof on those that want to undertake wildlife trade to show us that it's safe, to show us that it's sustainable, to show us that it can be effectively regulated before we open Pandora's box and we can't put it back in. So I think it needs a change of mindset to address those issues while we get up to speed with the kind of issues that Craig was talking about there.
Great. Thank you, Matthew. Barbara? Oh, I think you're muted, Barbara.
Yeah, so
Thank you.
thank you. Apologies. So if I had to prioritize something, I would say that it would be to integrate wildlife trade risk explicitly and firmly into national and international regulatory frameworks. In CITES, for example, which regulates legal trade, this has not been embraced so far. And it would include recognizing the One Health concept as a core component of pandemic prevention and allocating dedicated resources for upstream interventions. So that would also be much more cost effective than responding to outbreaks and would deliver broader co-benefits for biodiversity, livelihoods, and long-term resistance. So basically, we are the source of the problem, and therefore we are the solutions. The solutions are in us, our behavior, our actions, rather than out there tinkering with animal systems. Thank you.
Thank you, Barbara. Sarah?
Yeah, I mean, just to sort of echo what people have been saying, I think that that we do. I mean, we need to focus on implementation. We need to focus on having the policies in place, but implementing those policies. And I think we have some really good examples out there already that can sort of tick a lot of these boxes. I mean, we definitely need to change the behavior of the traders and the consumers, and we have examples on how those things can be taking place. We also need, when looking at things like welfare and how wildlife is traded and kept in captivity and transported. I mean, Sue went into a lot of these issues, but I mean, we have examples from livestock and the minimum sort of biosecurity and hygiene standards that are around the raising and transport of livestock and marketing. And we need to really make sure that those are in place, because you talk about minimum cage size, you talk about, essentially ways in which they're transported that do at least attempt to bring welfare standards into place. And then we also really need traceability that goes along the trade chain, so that we basically can reduce the risk along the entire trade chain.
Thank you, Sarah. So we need to move on soon, but I see some hands raised. Susan and then Craig.
Yeah, I'll be really brief. Governments and others need to stop business as usual. Tweaking it a little bit of improving the conditions, business as usual, we will have another epidemic and we will have another pandemic. So governments need to actually, and we all need to work with our government partners to change business as usual. That's a brief answer, but that's really what needs to actually fundamentally change. I agree with everything that was said, but if we want to avoid another pandemic, serious change needs to happen. Thank you.
Thank you, Susan. Craig, you
Yeah,
had your...
yes, thanks. I just wanted to say one last thing, linked to the title of the talk and the title of the organization, which is Alliance. This is not a unique issue. We have a global pandemic going on right now where there's significantly a gross inaction by our governments, and that's antimicrobial resistance, something that's less complicated to control than the wildlife trade. And I bring that up not as a pessimistic note, but as a note to say that our alliances to find solutions need to go beyond our usual players. Just as Susan was saying that we need to go beyond our usual governments and policy issues, we need to reframe how we think about this problem. The idea of behavior change is a massive issue that's been struggled for centuries, but there's others and other people in other sectors dealing with this. And to broaden your own personal alliances to see how others are conceiving solutions will be a way to help amplify and accelerate changes you're trying to make, even at the local level, if not at the international level.
Perfect. Thank you. Just Hanging, just to check if you would like to say something.
I would just agree with everything people have just said, and maybe from different angle is we think about we have policy, we implement policy, but for me, I would like to look at what's happening on the ground and listen to people and listen to the people living in local community. They want change, they want better life, they want better livelihood, safe for human and for their animals. They're doing something, they want to do something. So there's a willingness from some communities. So take that chance and make some change moving forward.
Perfect. Thank you so much. Yeah, and especially thank you to all of our panelists for your time, for sharing these valuable insights, and to our audience. So the conversation doesn't end here. We will have two exciting presentations of projects that were implemented in collaboration with the Alliance. And this will be followed by a QA session where you, the audience, will have the opportunity to ask questions directly to our experts here in their own fields, in their respective fields. So yeah, I will now hand it to Jake Brunner, who will present key findings from the IUCN project in Vietnam and the next steps on designing Nature for Health project. So he will talk more about it. Jake Brunner is head of IUCN's Lower Mekong sub-region. Welcome, Jake.
Good afternoon, good morning, wherever you are. Sophia, can you hear me? Can everyone hear me? Yeah, great.
Yes, we can hear you.
Jake Brunner, head of IUCN's Lower Mekong, based in Vietnam. And I'm going to talk about the Vietnam situation.
Maybe not anymore.
Oh,
yeah? Okay.
Yeah? Okay. I'll keep going. And I'm going to talk specifically about the issues with particularly the illegal wildlife trade and zoonotic disease risk in Vietnam. So this is a diagram I rather like. It's from a Nature paper published in 2020, and it shows pretty accurately the current situation, not just in Vietnam, of course, in many countries. We've declined in terms of wildlife. There's been a huge reduction in wildlife, and the date 2010 is actually a sort of tragic because that was when the last Javan rhino was shot and killed in Cat Tien National Park in southern Vietnam, and that really was a big moment in sort of conservation history in Vietnam, because huge amounts of money, millions and millions over the years, have been spent to protect that last subspecies, and it failed, and that triggered a lot of questioning about what went wrong. All this effort, all this assistance, yet the hunting continued. This iconic creature, and it's probably fair to say that we're continuing in Vietnam down that grey line. We talk about the sunny uplands. Maybe we're sort of that yellow line. We have ambition to shift to the green line, but realistically, we're continuing to decline in terms of wildlife health and populations, and this has been driven primarily by the illegal wildlife trade. There has been significant habitat loss, but there's also been very significant reforestation in Vietnam. In fact, Vietnam is a global leader in reforestation. 43% forest cover, much more than Thailand. But it's extremely low quality. A lot of it's monoculture plantations. So we have a significant problems both in terms of lack of wildlife and poor quality. And these really come together. This diagram is prepared by someone called Andy Wilting from the Leibniz Institute of Zoology Research, and it just captures some important points. So on the left, you've got a sort of a healthy forest with a full complement of wildlife. Now, within that forest, Susan was talking about tens of thousands of unknown coronaviruses. Some of them are probably there. But viruses and other pathogens are sort of maintained in a balance because you've got a functioning ecosystem with prey and predator, a full sort of mature forest structure. But we don't have that anymore in Vietnam. We're on the right side. And that's where the forest has been simplified. Pretty well all the commercially valuable wildlife, except in some of the remotest parts of the country, have been extirpated, and that has big impacts. We've eliminated the seed dispersers. 50% to 80% of all tropical plants depend exclusively on animals to disperse their seeds. And that's particularly the primates and the birds and some of the large ungulates that sort of create spaces for seed dispersal. We've obviously simplified dramatically the natural ecosystem, and we've created space in doing so for rodents, dogs, and other disease vectors. So we're very much, if you like, our landscape has been defaunated, and that has also gone together with very poor quality forest. Now, the grant that Sophia mentioned was fairly short, end of 2024 through to May 2025. And there were several sort of activities, but the one I want to talk about was an analysis of zoonotic disease risks along the illegal wildlife chain. A lot of good work has been done by WCS, FAO and others on wildlife markets, wildlife farms. And I think there are something like 10,000 in Vietnam, and that's a huge sector in itself. This is really focusing on the illegal wildlife trade. And if I read the guidelines, Vietnam really exemplifies the problem, because Vietnam exhibits all four of the WOA risk factors. First, the trade form. This is mostly live animals, which pose higher risks than processed wildlife. The second factor is animal welfare. There's stress from capture, transport, holding, which increases disease susceptibility. That was mentioned earlier about stressed animals shedding viruses. There's a lot of wildlife mixing. We're combining animals from all sorts of different origins and different species, and that increases the risk of transmission. And fourth, our supply chains, which are informal, unregulated, and these create multiple high-risk interfaces. At the end of May 2025, we organised a workshop in collaboration with One Health Partnership. And I think it's fair to say this is the first time the One Health Partnership in Vietnam, which was founded in 2003, really was involved in biodiversity and nature. Nearly all of the discussions has been on farming or disease screening, public health issues. And this then led into this Nature for Health proposal that I'll mention a bit later. Now, here are some of the conclusions and recommendations, four of them from the workshop. First of all, there's an almost sort of infinite demand for disease screening, almost sort of irrespective of the actual risk and cost, associated with putting in place the protocols and systems to screen disease. If you look at what's going on in Vietnam, the key area where we need to improve disease screening is in the rescue centers. Huge volumes of wildlife are being shipped to rescue centers, and this is where we need to invest more in disease screening, both for the animals but also for the animal handlers. So this is arguably the highest risk interface when it comes to human beings and the illegal wildlife trade. Second, since the criminal code was revised in 2018, and that criminalized the trafficking of wildlife, there's been a boom in trafficking. Confiscations have sort of gone through the roof, and this is why we have so many wildlife being transferred to rescue centers. Now, there are a lot of data held by government, CITES office, the Hanoi Wildlife Rescue Center, that's probably the biggest center, various NGOs. But something I've noticed, there's a lot of data collection, there's almost no data analysis, no effort to look at patterns, trends over space and over time. And that's, I think, a huge gap. There's a lot more, and I've, maybe there's some reluctance to actually do much analysis. That wouldn't surprise me. But we're sitting on a lot of data, and we need to take advantage of that. A third point is linked to the first point about sort of wildlife numbers. What's happening right now is protected areas are establishing these sort of rescue centers, both because they're struggling to handle confiscated wildlife, but also as tourism opportunities. And we have this sort of mushrooming of rescue centers, which are sort of slash tourist venues. And there's all sorts of risks, both in terms of sort of human risk, but also animal welfare problems in these. And there is no sort of national strategy, no national plan. And we need to distinguish between sort of conservation breeding centers, which can and should be linked to protected areas, versus the quarantine centers. And those should probably be on the main roads, linked to facilities where they can do quick screening and so forth. So these are some of the reforms, if you like, that need to be in place. Now, the third point is, relates to some of the points that were just discussed about sort of how do we move from sort of policy to implementation. And this is a problem we face all the time in Vietnam. We have a perfect storm of risk factors. I mean, if there's any country that's going to trigger the next COVID pandemic, it's probably Vietnam if you look at it objectively. Yet we find that the case for primary prevention through nature conservation, and this was Susan's point, is hard to make. And it may be that hard in any country where we tend to discount, big but infrequent, disasters. And we spend a lot of time thinking, what are the other arguments that we can marshal? One of them, when it comes to forest quality and the importance of wildlife to maintain natural regeneration, is, as I said, we've got 43% forest cover. 80% of that is pretty rubbish forest. We're getting hit by more and more of these tropical storms hitting in sort of September, October, November, coming in off the EC. And mountains are collapsing, landslides, a lot of people are being killed. despite the best efforts by government with rapid response. But these are devastating events. And what the public are now starting to ask questions. Those acacia forests are not protecting us. What's happening? So questions are being asked for the first time in the public domain. And if we could link, healthy wildlife with healthy forests, then that's an argument. A second thing is there is a, particularly post-COVID, a real boom in tourism to protected areas, particularly by younger generations looking for sort of clean, safe scenery and experiences. There's perhaps less interest in sort of mass tourism and more interest, well, there's still a lot of interest in mass tourism, but more interest definitely in nature-based tourism. And there's an opportunity here to link it to national pride, as well as, identifying wildlife as a viewing asset. And there's more talk, and this is really recent, this is, I'd say, in the last 6 months in Vietnam within government about rewilding. If you think of that curve I showed you at the bottom, we've probably reached rock bottom. And now we are, through necessity, if you like, talking about restoration, recovery, instead of, nature being something that is sort of no general interest, sort of mainstreaming it. And the last point, and this is perhaps a more short-term thing that we can do, is if you think about the amount of money the government is spending on work by the police, law enforcement officials to traffic, to interdict wildlife, to transfer it, put it in rescue centres, to build new cages, in response to the sort of this boom. These are direct costs, and we need to. It shouldn't be too hard to do a sort of an analysis, summarize those costs and say, Mr. Minister, this trade is costing you sort of $100 million just in direct police force time alone, let alone the reputational damage and so forth. The last slide is as part of this Nature for Health global program, Vietnam was one of the 6 Phase 1 countries, and it was actually the first one to get funded for the implementation. We had a sort of a 1 year, almost 1.5 year scoping phase. The project was approved in January, and I think one of the reasons it was approved was because we really emphasized this prevention at source, this primary prevention, stopping the snaring that's going on, in particular within the forest.
Sorry, Jake, just 1 minute more, if it's possible to.
That this is the last
start
slide.
wrapping. Thank you. Sorry.
So I won't go into the details, but basically, can we work with the police, local communities, protected area managers, animal keepers, to more safely and efficiently handle confiscated wildlife, but also to start to reintroduce wildlife? And this is part of connecting the circle, if you like. And this is what we're trying to achieve in terms of sort of the prevention at source or primary prevention. I'll stop there. Thank you very much.
Perfect. Thank you so much, Jake. So now we're gonna move to the next presentation. So we have Eugenio Sartoretto. He's who is legal coordinator of the legal component from the Sustainable Wildlife Program at FAO, and he will present also a project that was developed and implemented in collaboration with the Alliance, Sustainable Wildlife Governance in Namibia, Cameroon, and DRC. The floor is yours, Eugenio.
Thank you very much, Sophia. Hope you can hear me, and thanks for having me here. And
yes.
Great, thanks. Thanks for having me here, and good morning, afternoon, and evening to all the attendees. So I'll try to be brief. What I would like to present you today is basically our eventually 2 cents, but hopefully effective contribution to address some of the gaps that we discussed, particularly during the first set of interventions. So in a nutshell, maybe let me start by presenting the program as a whole. This is the Sustainable Wildlife Management Program. This is an initiative that is mostly EU funded, yet has received a contribution from the French Development Agency as well as by the Alliance. And the main goal of this program that started in 2018 is to contribute to the conservation of wildlife, their habitats and associated services, while securing the food and livelihood of the local people who depend on these resources and reducing the risk of zoonotic spillovers from wildlife. Is led by FAO, but is implemented through a consortium of partners, which include CIFOR, ICRAF, CIRAD, and WCS. The program is currently being implemented, or has been implemented over 16 countries across Africa, Asia, and Africa, Caribbean, and Pacific region, and is being articulated over 5 different components. Today's and I'm going to focus on the legal component, which is the one that has received the funding and the support from the Alliance. Not because it's more important than the others. Basically, what I think is important to start from is the assumption we had. Our assumption is that a strong legal framework are essential for wildlife conservation, for food security, and reduction of zoonosis. However, many laws and policies struggle to keep up with critical and evolving environmental and social norms and needs. This assumption generates what is the main challenge that we try to address. And this challenge is that in order to have reform processes that are effective, which is one of the challenges that has also been raised before, those processes should be transparent, inclusive, and participatory. Yet, clear, accessible legal information remains out of reach for many, too many maybe, highlighting the urgent need to bridge this gap. In other words, there is often not a lack of legal framework, but the legal framework that exists is not known by people, not accessible by people, and therefore is difficult to envisage whether there are gaps and how these gaps need to be addressed. So our solution to that, or what we found as a solution to that, is the Legal Hub. The Legal Hub is basically an online platform, which I would say is probably nothing new in itself. Yet, it does offer country legal profiles that are prepared by national legal experts. So through this, we also contribute to create a stronger knowledge at a local level using thematic legal diagnostic tools. I'll give you more insight on those thematic diagnostic tools at a later stage. This accessibility is vital for informed decision-making and encourage dialogue among stakeholders. Again, to break down those silos that some of you have raised before. The profiles are also reviewed by government, which contributes creating a sense of ownership in terms of what does and what doesn't work in the legal framework. And these profiles indeed identify strengths and weaknesses in laws and policies across all the sectors that relates to sustainable wildlife management, such as lands, ecosystem, wildlife management, animal production, animal health, and food safety. Now, for certain countries, we also have provided a focus on customary law and practices, as we consider this as a fundamental aspect, especially in those countries where statutory law is disconnected from customary law, and that's another gap that might need to be bridged. The Legal Hub, in our intended purpose, but also in practice, and we do have evidences of it, ensures that those in position of authority are equipped to respect, protect, and fulfill the rights of local communities when it comes to wildlife and wildlife trade, but also to empower those communities by ensuring that their rights are recognized, are upheld, and particularly regarding the management of wildlife and their trade. Now, moving from the broader to the narrow angle, I said earlier, I've named earlier this legal diagnostic tool. So the legal diagnostic tools are basically a set of guiding questions that are specific to all the sectors that are relevant to sustainable wildlife management. So from 2018 up until this year, actually last year, our diagnostic tool consisted in a set of seven sectors. We had preconditions, which refers to land management, land tenure, and land use management. We had consumption use, which is about hunting and fishing. We had non-consumption use, which is about ecotourism. We had human-wildlife conflict, animal production, animal health, and food safety. Now, thanks to the project that the Alliance supported, we've been able to finalize and publish the profiles for Namibia and Cameroon, while the one for DRC was already published but has been updated. The interesting thing is that these sectors have therefore facilitated a clear understanding, including from all the national stakeholders, of how the legal framework in these three countries is organized and what are the main gaps and gray areas when it comes to wildlife and wildlife use. This is the pathway that's used to reach to that end. Because indeed, completing the profiles is not the end of the journey; is possibly the beginning of a new journey. Indeed, when the governments reach out to us, we try to sit down with them to agree on priority sectors. Again, in our dialogue with the government, we try to avoid focusing on a single area. Again, to address the aspect that we discussed before on the importance of breaking down silos and showing the interconnections between different sectors and legislation. We therefore started, once the priorities are identified, we start collecting all the relevant policy and legal instruments, because it is important to have a clear overview of what is out there, what exists, what are the applicable rules, so to best identify what is missing. We also do the same for documenting customary norms and practices, and then we move towards the phase of the legal analysis compilation. It's only after the analysis is compiled that this is being technically reviewed by FAO as well as by government. This is an essential step of the process to make sure that, as I said earlier, the government fully owns the result of the analysis. This is fundamental because at that point, this is the point where we start developing a stronger institutional dialogue with government to fill those gaps or to address those loopholes and those gray areas in legislation. Now, I said earlier that we do have evidences of this being useful. Well, the evidences we have are the fact that the Legal Lab has visited more than 100,000 times between 2022 and 2025. So basically since the Legal Hub exists. But more than that, the hub has supported 42 normative instruments across the 13 countries where the Legal Hub has been published. We've been able to support the drafting or the amendment of 9 laws, 23 regulations, 2 policies, and 8 management plans across the countries where I said. Most importantly, again, thanks to the support of the Alliance, we've been able to develop a wildlife policy in DRC, as well as one management plan. In Cameroon, we've been working on a decree to implement the new forestry legislation. And in Namibia, we've been able to provide a set of edits, I would say, to the wildlife bill. So this is some concrete outputs of how the contribution of the Alliance we were able to make. Moreover, in Cameroon, as you know, is hosting the COMIFAC. So the activity that we are being able to support also go towards facilitating a review and harmonization of the legal framework across all the countries in the sub-region. Yet, since 2024, we've been taking this to a different level. We've realized that our set of 7 diagnostic tools was probably too limited in terms of thematic scope as well as in terms of granularity. And therefore, we came up with the idea of turning the 7 tools into 18 tools, which have a more comprehensive and more granular dimension, and are those that you do see in there. However, we wanted to also bring this out of the boundaries of a specific program or a specific organization. And this is why we've been reaching out to several other organizations. Most of them are also members of the Alliance, in particular, the World Organization for Animal Health, which have provided an incredible amount of inputs and strong contributions to the finalization of legal diagnostic tools, which currently do reflect a much more cross-sectoral dimension, covering also the key principle of the main international environmental agreements, such as CITES, such as CMS, the Wetland Conventions, and the Convention on Biodiversity. Now, one of the other aspects that were raised before is in relation to the One Health approach. We've tried our best, and I think we can generally say that this approach that we've undertaken does implement One Health approach. How this? Well, first of all, because we've been able to widen the scope of the legal diagnostic tools. As you've seen, we are encompassing land tenure, food security, animal health, wildlife management, habitat management. So all these are together. And at the same time, we've also been able to strengthen the interconnection between all of this, developing a specific methodology that we apply throughout consistently with governments. Now, I just give you a quick overview about this methodology, and I promise you I'm just one slide to go. This is what overall it looks like. This is an infographic that we use to engage with government. We show government how all these sectors are interconnected. And then when we ask government to operate a choice, we want this choice to be informed and to possibly go beyond a specific sector, because one sector alone doesn't address the problem. A problem is possibly addressed if the government is able to choose and pick the sectors that are part of either one or multiple policy areas, such as health, natural resources, and agriculture, that are interconnected with one another. This is a fundamental part of the exercise to be able to address the problem in more effective manner. Last but not least, in order to, since 2024, thanks to the impact we had, the Legal Lab is now growing both geographically and in scope. So the new legal diagnostic tool have been created and have been reviewed by many partners. And now, in order to be able to implement this across many other countries, now up to 20 by the end of 2026. We developed a data entry backend with an artificial intelligence built-in system, which doesn't replace the legal analysis, but it does facilitate it enormously. And this might facilitate the scaling of the application of the Legal Lab throughout, ideally with the intention of stimulating at least and changing that business as usual attitude that Susan has wisely raised before, and to facilitate policy and legal frameworks that are more suitable to facilitate sustainable management of wildlife and reducing zoonotic risks in relation to wildlife trade. Thank you very much.
Perfect. Thank you so much, Eugenio and Jake, for your presentation. So we are a bit behind of time. We are gonna start the QA session. So please feel free to add your questions to the QA part. We already have a couple. So I'm gonna read them. I'm going to read them. A question from Amanda. How can we collaborate with a communication specialist, or how can we communicate strategically with the community to minimize the risk of fear or misunderstanding about health or disease in wildlife? Especially when sometimes there is a lot of research gaps in the sectors. Susan, would you like to answer this question?
Yeah, I'll answer it very quickly in the interest of time. Join the Alliance. please join us. There are a lot of experts in the Alliance. There are working groups looking specifically at this issue. So I don't know you, Amanda, but please do join the Alliance. Thank you.
Thank you, Susan. We have Ajuka Nakaniwa. I hope I'm pronouncing it well, your name. Ajuka is asking, what kind of obstacles or challenges do you see regarding international regulations and frameworks on wildlife trade? Yuka says that there might be conflicts of interest between trade related to economic interests and the prevention of spillovers and other issues due to different states' priorities. Also, perhaps someone from the Alliance can elaborate on this. Craig, Barbara, Hangi, Susan.
I'm happy to make a comment if you wish, Sophia.
Yes, please, Matthew.
Yeah, just to say, I mean, yes, there are inevitably conflicts of interest in anything that has economic value attached to it, and the wildlife trade is no different to other sectors in that regard. But I think one of the things that was touched on earlier is think about the people we're messaging and how the people we need to message to and how we need to deliver that message to them, because it's been mentioned several times here, the cost of prevention at source dramatically outweighs the cost of dealing with another pandemic. And it's those kind of elements in our messaging that need to help kind of shift this business as usual thinking and to deal with some of those points and allow us to find ways to tackle those conflicts and trade-offs where they arise.
Thank you, Matthew. I hope we have Barbara, please.
If you still want me to speak, or are we?
Yes, yes, please.
Yes. Yeah, I think it's a really important point. And one of the Alliance-funded projects that I was involved in Vietnam, Bhutan, and Mongolia used Buddhist leaders and leveraged the innate affinity for compassion and interconnectedness of all life to piggyback the One Health message and and leverage it for demand reduction in those three countries. And particularly, we ran into all sorts of political problems in Vietnam, so our time window was shortened. But it was the first time that religious leaders in the Buddhist community took on what seemed initially quite a worldly issue. So find leaders that are respected in your communities and try to persuade them of the benefits for those communities of not using, of using less, of implementing certain regulations, and then let them help you, respected leaders in the communities, to break through the deadlock that we often run into through conflict of interests in international and political contexts.
Thank you. Susan, I see your hand.
Yeah, thank you. I'll be brief, just building on what Matt and Barbara said. Of course, there are pressures on governments, and there are pressures on government from the people who profit from wildlife trade. And I think we need to look at the wildlife trade, even wildlife for consumption, but also pet trade, in the context of working with individual governments. What is their interest? Yes, there are economic pressures from those who profit from the trade, but what will it cost if we have another pandemic because some people wanted an exotic species or wanted to eat an exotic species? So I think it's really important to work with governments using a One Health approach on this cost-benefit analysis without naming countries. Some countries have really changed their practices since COVID. And some countries really haven't done anything at all. There are economic and political pressures from traders, but I think it's really important to make the case with governments. on the cost and benefits of taking strong action. At the same time, we need to continue to work with local communities, particularly those dependent on wildlife living in the forest, to ensure that their use of wildlife is safe for them, without necessarily taking that wildlife to international trade. But that's what the SWIM program and other programs do, ensuring that those communities are also safe from pathogen spillover. So there are different approaches. But the question from Yuka is absolutely correct. There are a lot of political and economic pressures, but we need to make the economic case to governments why it is in their long-term interests to take strong action. Thank you.
And just to finalize, Sarah, please.
Yeah, hi. I'll really be brief because I know we're running out of time, but just to build on the previous speakers, which I completely agree with, but I think that part of the problem is that we see it as we're siloing these issues too much. We see wildlife trade and let's tackle wildlife trade and how can we figure that out? But I think one of the beauties of the One Health approach is that it does see this a little bit more holistically. It's not just wildlife trade, but wildlife trade as it's intrinsically linked to disease and even law enforcement and global health and things like that. And I think if we take these, issues out of their silos and see them as one issue, then we can start to think about how do we fund that one issue and how do we deal with this one issue, because they're very overlapping issues and they should be presented that way.
Very well said. Thank you so much, Sarah. Then, well, unfortunately, it's time to finalize this session. And we thank you, all of you, for your time, for your engagement throughout this session. So as we have seen today, health risk in wildlife trade are real, are complex, are urgent, but they are not beyond our reach. So tackling them requires everybody working hand in hand across disciplines, sectors, borders, right? As Sarah said, following holistic approaches of the One Health, also being more, governments, as Susan said, cannot continue business as usual. So we need to be more receptive and engage more about the needs and the priorities of governments and find different ways of working together. Similarly with communities and the role of and the need of moving from policy to implementation, right? Closing these gaps. We have seen throughout this session different initiatives taking place at different regions with different capacities. Also, we can see opportunities for legal reforms, for communication, for education programs, of working with different stakeholders, including law enforcement agencies and governments. So, yeah, none of this work is possible alone, and it takes a community. And I will end by saying also that if you or your organization is not yet a member of the Alliance, please, we invite you to join our growing community. And thank you so much for today. We hope you have a really nice day. And thank you all, our speakers of today.
Thank you.
Thank you. Bye-bye.
Thank you very much.